Lesson: Health and Safety in Remote Work Environments. Health and safety in remote work environments have become pivotal concerns as organizations across the globe adapt to new working paradigms. The shift towards remote work presents unique challenges and opportunities for HR leaders tasked with ensuring the well-being of employees. Central to the discussion of health and safety in remote work is the understanding and implementation of comprehensive frameworks and tools that address both physical and psychological well-being. The essence of remote work safety lies not only in the prevention of physical injuries, but also in the cultivation of a work culture that fosters mental health and productivity. The physical health of remote workers is paramount, as the home office environment often lacks the ergonomic infrastructure of a traditional workplace. Ergonomic injuries, such as carpal tunnel syndrome and back pain, are prevalent among remote workers due to poor workstation setups. To mitigate these risks, HR leaders can implement the use of ergonomic assessment tools that employees can utilize to evaluate and adjust their workstations. The Rapid Office Strain Assessment is a practical tool that enables employees to assess their own work environment and make adjustments to reduce strain and enhance comfort. By incorporating such tools into a remote work policy, organizations can empower employees to take proactive steps in preventing ergonomic injuries. Moreover, the psychological aspects of remote work must not be overlooked. Isolation and the blurring of work-life boundaries can lead to increased stress and burnout among remote workers. To combat these issues, HR leaders should develop frameworks that promote mental well-being and work-life balance. One effective approach is the implementation of structured communication protocols that ensure regular check-ins and feedback loops between employees and managers. This strategy not only maintains engagement, but also provides an avenue for employees to express concerns and receive support. Furthermore, organizations can offer virtual mental health resources, such as counseling services and stress management workshops, to support employees' psychological well-being. The legal implications of remote work health and safety cannot be ignored. HR leaders must be cognizant of the regulatory frameworks governing remote work in different jurisdictions. For example, in the European Union, the Occupational Health and Safety Framework obliges employers to ensure the safety and health of remote workers in the same manner as those working on site. This includes conducting risk assessments and implementing preventive measures tailored to remote work settings. Compliance with such regulations not only protects organizations from legal liabilities, but also reinforces a culture of safety and responsibility. Addressing the challenges of health and safety in remote work environments also involves leveraging technology to monitor and enhance employee well-being. Wearable technology, such as fitness trackers and health monitoring apps, can provide valuable insights into employees' physical activity levels and stress indicators. By integrating these technologies into the workplace, HR leaders can encourage a culture of health awareness, prompting employees to take actionable steps towards better health. Additionally, data collected from these devices can inform organizational policies and interventions aimed at improving overall employee well-being. Case studies from organizations that have successfully implemented remote work health and safety strategies offer valuable lessons. For instance, a multinational tech company introduced a comprehensive remote work policy that included ergonomic assessments, mental health resources, and regular virtual check-ins. As a result, the company reported a significant reduction in employee turnover and an increase in job satisfaction. This example underscores the importance of a holistic approach that addresses both physical and mental health in remote work environments. Furthermore, statistical data highlights the growing importance of addressing remote work, health, and safety. A survey conducted by the International Labor Organization found that 41% of remote workers reported experiencing increased stress levels, while 65% cited poor ergonomic setups as a major concern. These statistics reinforce the need for HR leaders to prioritize health and safety in remote work policies to ensure a sustainable and productive workforce. In conclusion, the responsibility of ensuring health and safety in remote work environments falls heavily on HR leaders, who must navigate a complex landscape of physical, psychological, and legal challenges. By implementing practical tools such as ergonomic assessments and structured communication protocols, organizations can create a supportive environment that prioritizes employee well-being. Additionally, leveraging technology and adhering to legal frameworks are essential components of a comprehensive remote work health and safety strategy. Ultimately, the effectiveness of these measures is reflected in enhanced employee satisfaction, reduced turnover, and a thriving organizational culture. As remote work continues to evolve, HR leaders must remain vigilant and adaptable, continuously refining their approaches to meet the changing needs of the workforce.